Okay, good morning everyone. Our lesson for today is about sampling plans. Okay, first we have to discuss first what is sampling. Okay, sampling is a process familiar to all of us. We make decisions and form opinions about phenomena based on contact with only a sample of them. Quantitative and qualitative researchers have different approaches to sampling. Quantitative researchers desire samples that will allow them to achieve a statistical conclusion, validity, and to generalize their result. They develop a sampling plan that specifies in advance how participants are to be selected and how many to include. Okay, qualitative researchers are interested in developing a rich, holistic understanding of a phenomenon. They make sampling decisions during the course of the study based on the informational and theoretical needs and typically do not develop a formal sampling plan in advance. Okay, the objectives of our study is, of course, number one, to identify the differences in the logic of sampling for quantitative versus qualitative studies. Okay, number two, to distinguish between non-probability and probability samples and compare their advantages and disadvantages in both quantitative and qualitative studies. Okay, number three, identify several types of sampling in qualitative and quantitative studies and describe their main characteristics. And lastly, evaluate the appropriateness of sampling method and sample size used in the study. Okay, but before that, we have um to differentiate, okay, or to discuss first or to define the different concepts or basic sampling concepts. Okay, population. Okay, population is defined as the entire aggregation of cases in which a researcher is interested. Okay, for an instance, okay, if a researcher were studying American nurses with doctoral degrees, the population could be defined as all US citizens who are registered nurses and who have acquired a PhD or Doctor of Nursing or other doctoral level degree. Other possible population might be all male patients who underwent cardiac surgery in certain hospital, okay, or all Australian children under age 10 with a cystic fibrosis. Okay, so you will determine kung ano ba yung type of population na i-study ninyo. For example, gusto nyong i-study lahat ng mga hypertensive patients or lahat ng mga nursing students. Okay, that is an example of the population. Okay, so a population may be broadly defined, involving thousands of individuals, or may be narrowly specified to include only hundreds. Okay, so eligible criteria, researcher, especially in quantitative researcher, specify the characteristics that delimit the study population. For example, consider the population of the American nursing students. Would this population include the part-time students? So, for example, American nursing students, i-include mo pa ba ang mga part-time students? Or would registered nurses returning to schools for bachelor degree be included? Researcher establish criteria to determine whether a person qualifies as a member of the population, although populations sometimes are defined in terms of characteristics that people must not possess through exclusion criteria. For example, excluding the people who does not speak English. Okay, target population naman is the entire population in which a researcher is interested. Okay? So, sorry. Okay, accessible population, okay? Accessible population is composed of cases from the target population that are accessible to the researcher as study participants. Okay, for example, Okay, the researcher target population might be all diabetic patients in the United States, but in reality, the population that is accessible might be diabetic patients in a particular clinic lang. Okay, so that would be your accessible population. Okay, next, sample and sampling. Okay, sampling, as I have defined kanina, okay, is the process of selecting a portion of the population to represent niya yung entire population. Okay, a sample is a subset, okay, of population elements. Okay, in nursing research, the elements or the basic units are usually the humans. Okay, researchers work with samples rather than with population because it is more economical and practical to do so. Okay, so representative sample is the one whose main characteristics closely approximate those of the population. Okay, information from samples can, however, lead to erroneous conclusions, and this is especially a concern in quantitative studies. In quantitative studies, a key criterion of adequacy is the sample's representativeness. Okay, very important yung representativeness when we are going to create yung sample natin. Okay? So, sampling bias is the systematic overrepresentation or underrepresentation of some segment of the population in terms of the characteristics relevant to the research question. Okay, sampling bias is affected by many things, including the homogeneity of the population. When we say homogeneity, is the quality or state of being all the same or all of the same kind. Okay? So, when we say the target population, ito yung usual na tinatanong natin, to whom do you wish to generalize the findings? Okay? Kanino mo gustong i-generalize yung finding? Okay, so that is the target population. Okay, the accessible population naman, to which population do you have access? Okay, sino ba yung mga respondents natin that are accessible for that kind of study? Okay, when we say the sampling frame naman, through what resource can you access them? Okay, a sampling frame is a list. Okay, ito yung list ng mga actual cases or the actual respondents from which sample will be drawn. Okay, the sampling frame must be representative of the population. Okay, when we say the sample naman is who is participating in your study. Sino yung mga magpa-participate sa iyong study. That would be your sample. Okay? Next is the strata. Okay, when we say strata naman, is the population consists of subpopulations. Okay, for example, from that populations, then magkakaroon ka pa ng major specific category. Okay, so that's what we call strata. Okay, strata are mutually exclusive segments of a population based on specific characteristics. Okay, for example, a population consisting of all registered nurses in the United States could be divided into two strata based on the gender. It can be male or female. Alternatively, we could specify three strata consisting of nurses younger than 30 years of age, nurses aged 30 to 45, and nurses 46 years old at or older. Okay, so yung strata mo naman is according to age. Okay, so strata are often used in the sample selection to enhance the sample representativeness. Okay, let's move with the um, sampling designs in quantitative studies. Okay, the two main sampling designs issues in quantitative studies are how the sample is selected and how many elements are included. The two broad types of sampling designs in quantitative studies are the probability sampling and the non-probability sampling. But okay, let's start with the non-probability sampling. When we say non-probability sampling, researcher selects element by non-random method. Okay? There is no way to estimate the probability of including each element in a non-probability sample, and every element usually does not have a chance for inclusion. Okay, non-probability sampling is often associated with case study research design and qualitative research. With regards to the latter, okay, case studies tend to focus on small samples and are intended to examine a real-life phenomenon, not to make statistical inference in relation to the wider population. A sample of the participants of cases does not need to be representative or random, but a clear rationale is needed for the inclusion of some cases or individuals rather than others. Okay, there are four primary methods of non-probability sampling in quantitative studies. We have the convenience, quota, consecutive, and the purposive. Okay, so let's talk about the convenient. Convenient sampling, when we say convenient sampling, okay, it entails using the most conveniently available people as participants. Okay, kung sino lang yung available or conveniently available na pwedeng maging respondents mo. Okay, but it is the weakest form of sampling. Kasi nga you haven't set any standards or characteristics before. So, kung sino lang yung available, so sino lang yung naging respondents mo. Okay, it is also the most commonly used, but then this is the most commonly used sampling method in many disciplines. Okay, example of convenience sampling. Okay, a nurse who distribute questionnaires about vitamin use to the first 100 available community dwelling elders, okay, is sampling by convenience. Kasi hindi ka na nag-identify sinabi mo lang na 100 available community dwelling elders, mga elders natin. So, sa kanila mo na lang distribute yung mga questionnaires. That is an example of convenient sampling. Okay, the problem with the convenient sampling is that available subjects might be atypical of the population, and so the price of the convenience is the risk of the bias. Okay, convenience sampling is selecting participants because they are often readily and easily available. Typically, convenience samplings tend to be a favored sampling technique among students as it is inexpensive and an easy option compared to other sampling technique. Convenience sampling often help to overcome many of the limitations associated with the research. For example, using friends or family as part of the sample is easier than targeting unknown individual. Okay, so let's move with the snowball sampling. It is also called as network sampling or chain sampling. Okay, is a variant of convenience sampling. Okay, just like convenience sampling. Okay, with this approach, early sample members are asked to refer other people who meet the eligibility criteria. This method is often used when the population is people with characteristics who might be difficult to identify. For example, persons who are afraid of the hospital. Okay, snowball sampling is a non-random sampling method that uses a few cases to help encourage other cases to take part in the study. Okay, thereby increasing the sample size. Parang it's a referral system. Okay, so it start with the convenience sampling, tapos you're going to identify if we have the same characteristics, tapos magre-refer siya ng another respondents. That is snowball sampling. Okay, this approach is most applicable in small populations that are difficult to assess due to their close nature. Example, secret societies and inaccessible professions. Okay, example of convenience sample study is from the Fraser and Polito in the year 2007 compared the efficacy of men versus women with multiple sclerosis. Okay, they use convenience sampling of 556 individual with multiple sclerosis. So hindi niya na sinab-categorize, okay, na-identify lahat sino yung mga individual na mayroong multiple sclerosis, then doon na siya nag-conduct ng kanyang study. That is convenient sampling. Okay? So moving on, quota sampling naman is the researchers identify population strata and determine how many participants are needed for each stratum. Okay, when we say quota sampling, it's a non-random sampling technique in which participants are chosen on the basis of predetermined characteristics so that the people or the total sample will have the same distribution of characteristics as the wider populations. Okay, as you can see on the example, okay, number and percentage of students in strata of the population, convenience sample, and quota samples. Okay, so ang strata niya is the gender. So, in-identify niya male and female. The total population is about 500. So, ang male doon is 100. So, it is equivalent to 20% of the total population, while the female is 400, comprising the 80% of the total population. When we say convenience sample naman, you wanted a 100, okay, 100 population or samples only. So, you have conveniently identify it. So, 5% lang yung inalat mo for the male, and for the female is 95%. So randomly kasi binigay mo lang yung, for example, questionnaires, tapos ang respondents mo are 10. That's the convenient sample. When we say quota sample naman, you have the equal tendency or equal distributions of the populations. Like for example, this. So what is the 20% of the 100 is 20. So you have allotted male as 20 respondents. Then what is the 80% of 100? That's 80. So you have identified female respondents as 80. Okay, 80 respondents. So a total of 100, wherein there is a representations of the respondents or the sample basing from the total population. Okay, so that is the quota sampling. Next, consecutive sampling naman, it involves recruiting all of the people from an accessible population who meet the eligibility criteria over a specific time interval or for a specified sample size. Okay? For example, okay, in a study of ventilated associated pneumonia in ICU patient, or the ventilated associated pneumonia or the BAF, if the accessible populations were patient in the ICU of a specific hospital, a consecutive sample might consist of all eligible patients who were admitted to the ICU over the 6 months period. So you have a set time interval or duration only. Okay? Or it might be the first 250 eligible patients admitted to the ICU. Ano? So, nag-set ka ng number of populations lang. It can be 250 lang na pasyente na na-admit sa ICU, or if 250 were the targeted sample size, kung yun yung targeted na sample size mo. Okay? Consecutive sampling is a far better approach than sampling by convenience, especially if the sampling period is sufficiently long to deal with the potential biases that reflect seasonal and other time-related fluctuations. Okay, when all members of the accessible population are invited to participate in a study over a fixed time period, the risk of bias is greatly reduced. Consecutive sampling is often the best possible choice when there is rolling enrollment into a accessible population. Okay, example of a consecutive sample, okay, on the study of Mayara and colleagues, okay, conducted a study to evaluate the factors associated with interruptions in enteral feeding or enteral nutrition in mechanically ventilated critical ill patients. A consecutive sample of 59 ICU patients who required mechanical ventilator and were receiving enteral nutrition participated in the study. Di ba meron tayong characteristics or meron tayong set na guidelines. Like, eto, ang sabi dito dun sa kanilang study, dapat nasa mech vent, and number 2, they are receiving enteral nutritions. So, After setting the number of samples, so ang ang kanyang naging respondents o kanyang naging samples, okay, are the 59 ICU patients who have received an enteral feeding or nutritions, and number 2 is nakakabit sila sa mechanical ventilation. Okay? So that's it. Okay, purposive sampling naman. Okay, purposive sampling, or what we call the judgment sampling, is based on the belief that researchers' knowledge about the population can be used to handpick some sample member. Okay, researcher might decide purposely to select subjects who are judged to be typical of the population or particularly knowledgeable about the issues under study. For example, purposive sampling is often used when researcher wants a sample of experts. Okay? Purposive sampling is a strategy in which particular settings, persons, or events are selected deliberately in order to provide important information that cannot be obtained from other choices. It is where the researcher includes cases or participants in the sample because they believe that they warrant inclusions. Okay? Here is the example of the purposive sampling under the study of Bande, Head, and colleagues in the year 2007 assessed the view or an international panel of experts regarding the state of nurse staffing and patient outcomes research. Okay, two rounds of survey were conducted with a purposively selected sample of researchers and administrators from 10 countries. So medyo mas higher itong purposive sampling because you are going to need key informants wherein they are experts in such field na kung ano yung concern ng study mo. Okay? So that ends our non-probability sampling under the quantitative studies. Okay? So next, we have the probability sampling naman tayo. It involves the random selection of elements from a population. Okay, when we say random selection, it is a process, okay, one in which each element in the population has an equal or independent chance of being selected. Okay, so one way to undertake random sampling would be if researcher was to construct a sampling frame first and then use a random number generations computer program to pick a sample from the sampling frame. Okay, probability or the random sampling has the greatest freedom from bias. Okay, but may represent the most costly sample in terms of time and sampling technique. Okay, so what are the four most commonly used probability sampling designs? We have the simple random, we have the stratified random, we have the cluster, and we have the systematic sampling. Okay, simple random sampling is the most basic probability sampling design. Researcher establish a sampling frame, a technical name for the list of the population elements. Okay, example of the sampling frame is if this nursing student at the University of Connecticut were the accessible population, often a roster of those students would be the sample frame. So kung sino yung mga estudyante na or nursing students who are at the University of Connecticut. Okay, if the populations were 500 bed or larger hospitals in the Florida, then a list of all such hospitals would be the sampling frame. Okay, simple random sampling is laborious process. Okay, developing the sampling frame, enumerating all the elements, and selecting the sample elements are time-consuming chores. Okay, particularly with the large populations. Moreover, it is rarely possible to get a complete listing of the possible elements, hence other methods are often used. Okay, example of the um, study which uses a simple random sampling is from the Knight Turner and the colleagues in the year 2007 conducted a survey of the registered nurses and licensed practical nurses to compare their experience with workplace violence. Okay, questionnaires were mailed to a random sample of 6,300 licensed nurses in Minnesota. Minnesota. Okay, so that is a simple random sampling. Okay, so let's move with the stratified random sampling. When you say stratified, so there is a subcategory. Okay, stratified random sampling. Okay, the population is first divided into two or more strata. Depende kung it can be in the gender, it can be on the um, civil status, it can be on the educational attainment. Okay, the population, as with the quota sampling, the aim of the stratified sampling is to enhance representativeness. Okay, for example, gusto mo lang lahat ng responses of the male other than the female counterpart. Okay, so stratified sample design subdivide the population into subsets from which elements are selected at random. Okay, stratification is often based on such demographic attributes such as age and gender. Okay, example of stratified random sampling from Eckwall and Holberg from the year 2007 studied the caregiver satisfaction among informal older caregiver who had participated in a postal survey of older people in southern Sweden. Okay, the original sample was stratified on the basis of the age. Okay, yung study nila, in-stratify nila through sa age or categorized through the age. Okay, questionnaires were mailed to 250 elder age 75 to 79 years old, 2,500 for the elder age 80 to 86, 84, and 2,000 elders age 85 to 89, then 1,500 elders age 90 and older. Okay, so stratified random sampling, researchers may sample either proportionately or disproportionately. Okay, so for example, if a population of these students in a nursing school in the US consists of 10% of African American, okay, 5% of Hispanics, and 5% Asians, and 80% are whites, okay, our proportionate number of 100 students, okay, stratified on race or ethnicity, would consist of 10, 5, 5, and 80 students from the respective strata. Okay, researchers often use of this proportionate sample naman whenever comparisons between strata of an equal size of are desired. Okay, in our example, the researcher might select 20 African American, 10 Hispanics, 10 Asians, and 60 whites or Americans to ensure a more adequate representations of the viewpoint of the racial minorities. Okay, you can use naman either proportionate or disproportionate stratified random sampling. Okay, next we have the cluster sampling. Okay, cluster sampling, there is a successive random sampling of unit. Okay, for a given number of case, cluster sampling tends to be less accurate than simple or stratified random sampling. Okay, despite this disadvantage, cluster sampling is more economical and practical than other types of probability sampling, particularly when the population is large and widely dispersed. Okay, cluster sampling is where the whole population is divided into clusters or group. Subsequently, a random sample is taken from these clusters, all of which are used in the final sample. Cluster sampling is advantageous for those researchers whose subjects are fragmented over the large geographical areas, as it saves time and money. The stages of cluster sampling can be summarized as follows. Number one is choose the cluster grouping, okay, for sampling frame, such as the type of company or the geographic region. Then number two, number each of the cluster, then select sample using the random sampling. Okay, that is the stages of cluster sampling. Next is the systematic sampling. Systematic sampling involves the selection of every case and case, okay, from a list, okay, such as every 10 person on a patient list. Or systematic sampling designs can be applied in such a way that an essentially random sample is drawn. Okay, first, the sample of the population is divided by the size or the desired sample to obtain the sampling interval width. Okay, the sampling interval is the standard distance between the selected elements. For example, if we if we wanted a sample of 50 from a population of 5,000, okay, our sampling interval would be 100. Okay, kasi 5,000 divided by 50 is 100. So, in other words, every 100 case of the sampling frame or yung list mo ng mga populations would be the sample. Okay? So next, the first case would be selected randomly by using a table or random numbers. If the random number chosen were 73, okay, the people corresponding to number 73, 173, 273, and so on and so forth would be included as the sample. Okay, ganun nangyayari yung systematic sampling. Okay, systematic sampling conducted in this manner is essential identical to simple random sampling, and often is preferable because the same results are obtained in a more convenient manner. Okay, example of this is from the Gillespie and colleague 2007 studied the resilience of operating room nurses. Okay, the researchers sent a survey of 1,430 nurses, every other member of the Professional Association for OR in the Australia. Okay, sampling size in quantitative studies. Okay, the number of these subjects in a sample. Okay, there is no simple equations can determine how large a sample is needed. Okay, but quantitative researchers often strive for a larger sample possible. The larger the populations or the larger the sample, the more representative it is likely to be. Every time researchers calculate a percentage or an average based on the sample data, the purpose is to estimate the population value. The larger the sample, the smaller the sampling error. Okay, sampling size in quantitative studies is a major issue in conducting and evaluating quantitative research. Statistical conclusion validity is threatened when samples are too small, and researchers run the risk of gathering data that will not support their hypothesis, even though those hypotheses are correct. Okay, large samples are no assurance of accuracy. However, when non-probability sampling, even a larger sample can harbor extensive bias. The famous example illustrating this point is the 1936 United States presidential poll conducted by the magazine Literary Digest, which predicted that Alfred M. Landon would defeat Franklin D. Roosevelt by a landslide. A sample of 2.5 million people participated in this poll, but biases arose because the sample was drawn from a telephone directories, o yun yung naging kanilang sample frame. Okay? So, yung telephone directories and automotive registrations during the Depression's year, when only the well-to-do or who favored London have a car or a telephone. Okay? So, there is a, anong tawag dito? Bias kasi nga eh. So, lahat ng mga merong telephones and who have car or yung medyo mas angat sa buhay is in favor with London. But then again, after the election, ang nanalo is the Franklin Roosevelt pa rin. Okay? So, tip lamang po, the sample plan is often one of the weakest aspect of quantitative studies. Most nursing studies use sample of convenience, and many are based on samples that are too small to provide an adequate test of the research hypothesis. Power analysis is not used by many nurse researchers, and research reports typically offer no justification for the size of the study sample. Small samples run a high risk of leading researchers to erroneously reject their research hypotheses. Therefore, you should be especially prepared to critique the sampling plan of studies that fail to support the research hypothesis. Okay, that ends the sampling in quantitative research. Let's move with the sampling in qualitative research. Okay, when you say qualitative research, almost always use small, non-random samples. Okay, this does not mean that qualitative researchers are unconcerned with the quality of their samples, but rather they use different considerations in selecting the study participants. Qualitative research is concerned with measuring attributes and relationships in a population, and therefore a representative sample is desirable so that the findings can be generalized to the population. The aim of most qualitative studies is to discover the meaning and to uncover multiple realities, and so generalizability is not a guiding consideration. Okay, what is the logic of qualitative sampling? Okay, qualitative research as such sampling question as who would be an informant rich data source of my study? Sino ba yung magiging key informants that can give them a significant answer to their studies? Okay, to whom should I talk or what should I observe to maximize my understanding of the phenomenon? Okay, so it can be on the experts in the field of certain or in the field of nursing, pwede yon. Okay, a critical first step in qualitative sampling is selecting the setting with high potential for information richness. Okay, so as the study progresses, okay, new sampling questions emerge such as the following: who can I talk to or observe? Who would confirm my understanding? Who would challenge or modify my understanding? Or who would enrich my understanding? Kasi sa qualitative samplings, they are more of the response of the person who are the key informants, ng study mo. Okay, thus as with the overall design in qualitative studies, sampling design is an emergent one that capitalizes on every information to guide the subsequent directions. Okay? So, qualitative researchers usually screwed probability samples. A random sample is not the best method for selecting people who will make good informants. That is, people who are knowledgeable, articulate, reflective, and willing to talk at length with researchers. Various non-probability sample designs have been used by qualitative researchers. Okay, so we have types of qualitative sampling. We have the convenient and snowball sampling. We have the purposive sampling, and we have the theoretical sampling. Okay, let's move with the convenient sampling. Okay, qualitative researchers often begin with convenient sampling. Okay, which is sometimes referred to as volunteer samples. Okay, volunteer samples are special likely to be used when researchers need to have potential participants come forward and identify themselves. Okay, for example, if we wanted to study the experiences of the people with frequent nightmares, okay, we might have difficulty or readily identifying potential participants. In such a situation, we might recruit sample members by placing a notice on the bulletin board or pwede sa newspaper or in the internet requesting people with nightmares to contact us. In this situation, we would be less interested in obtaining a representative samples of the people with nightmares than in obtaining a diverse group representing various experiences with nightmare. Okay? Only efficient but not preferred sampling approach. This is the economical way to begin the sampling process. Okay, the key aim in qualitative studies is to extract the greatest possible information for the small number of informants in the sample, and a convenient sample may not provide the most information rich sources. Okay, example of the convenient sample under qualitative. Okay, Woodman and Radziminski on the year 2007 explored the experiences of the women following breast reduction surgery. Okay, a convenient sample of 9 women was recruited during their follow-up visits. Okay, next, the snowball sampling. Okay, qualitative researchers also use snowball sampling, asking early informants to make referrals, okay, for other study participants. Okay, this method is sometimes referred as nominated sampling because it relies on the nomination of the other already in the sample. Okay, a weakness of this approach is that the eventual sample might be restricted to a rather small network of acquaintances. More, Moreover, the quality of the referrals may be affected by whether the referring sample member trusted the researcher and truly wanted to cooperate. Okay, example of the snowball sampling by Yu 2007 explored the influence of the Chinese culture on attitudes towards sexual behavior among British-born Chinese teenagers. Snowball sampling was used to identify the 20 teenagers and their Chinese-born parents. Okay, so from that specific person, so nagkaroon ng referral hanggang sa ma-identify mo yung 20 teenage and their Chinese-born parents. Okay, purposive sampling. Okay, within the purposive sampling, okay, maximum variation sampling is often the sampling mode of choice in qualitative research because it is useful in documenting the scope of a phenomenon and in identifying important patterns that cut across variations. Other strategies can also be used advantageously, however, depending on the nature of the research questions. Some qualitative researchers appear to call their sample purposive simply because they purposely selected people who experience the phenomenon of interest. However, exposure to the phenomenon is an eligibility criterion. Okay, the population of interest is composed of the people with that exposure. If the researcher then recruits any people with the desired experience, the sample is selected by convenience, not purposively. Okay, purposive sampling implies an intent to carefully choose particular exemplars or type of people who can best enhance the researcher's understanding of the phenomenon. Okay, within purposive sampling, several strategies have been identified. Number one, we have the maximum variation samplings, involves deliberately selecting cases of a wide range of variations on dimensions of interest. Extreme case sampling provides opportunity for the learners from the most unusual and extreme informants. For example, outstanding successes and notable failures. Okay, typical case sampling involves the selection of participants who illustrate or highlight what is typically or average. The criterion sampling involves studying cases who met a predetermined criterion of importance. Okay, example ng maximum variation sampling is from Spilbury and colleagues in the year 2007 performed an in-depth study of patients' perceptions of the effect of the pressure ulcer on their quality of life. A sample of 23 patients were deliberately selected to be varied in terms of gender, age, type of ward, reasons for hospital admissions, and anatomical sites of the pressure ulcer. Okay, next, theoretical sample. Okay, theoretical sample is a method of sampling that is most often used in grounded jury studies. Okay, take note of that. Involves decisions about what data to collect next and where to find those data to develop an emerging jury optimally. Okay, the basic question on theoretical sampling is what group or subgroup should we researcher turn to next? Okay, groups are chosen as they are needed for their relevance in furthering the emerging conceptualizations. Okay, these groups are not chosen because the research begins, but only as they are needed for their theoretical relevance in the developing further emerging categories. Okay, theoretical sampling is not the same as purposive sampling. Okay, iba po sila. The objective po ng theoretical sampling is to discover categories and their properties and to offer new insights about interrelationships and occur in this substantive theory. Okay, example of theoretical sample or sampling from Kriegel and Mick on the year 2007 uses theoretical sampling in their grounded theory study of the process that occurs after nurses perceive that they have made a mistake in their clinical practice. After interviewing and analyzing the data from their first three respondents, the researchers realized the theoretical importance of nurses' decision to stay in the hospital practice. Okay, they specifically sought to include in their sample nurses who no longer practice in the hospital setting. Okay, sampling size in qualitative study, there is no rule for sampling size in qualitative researches. Okay, or research. Sample size is usually determined based on informational need. Okay? A guiding principle in sampling is the data saturations or gaano ba ka-bulk yung data na makukuha mo sa iyong respondents or sa iyong subject. That is sampling to the point at which no new information is obtained and redundancy is achieved. Saturation depends on the number of factors. For example, the broader the scope of the researcher or the research question, the more participants will likely be needed. Okay? For the data quality can also affect sample size if participants are good informants who are able to reflect on their experiences and communicate effectively. Saturation can be achieved with a relatively small samples. Also, if longitudinal data are collected, fewer participants may be needed because each will provide a greater amount of information. Okay, next, for the type of sampling strategy may be relevant. For example, a larger sample is likely to be needed with maximum variation sampling than with the typical case sampling. Okay, let's move with the sampling in ethnography. Okay, ethnographers may begin by initially adopting a big net approach. Okay, that is mingling with and having conversations with any or many members of the culture under study as possibles. Okay, then although they may converse with the many people, usually 25 to 50, ethnographers often rely heavily on the small number of key informants who are highly knowledgeable about the cultures and who develop special or ongoing relationship with the researchers. Usually, ito yung mga ninuno or pinakamatatandang tao sa isang ethnic group. Okay? For example, okay, an ethnographer might decide to seek out different types of key informant based on their role. For example, healthcare practitioners or advocates. One is a full of potential key informants is developed. Key considerations for final selections are their level of knowledge about the culture and how willing they are to collaborate with the ethnographer in revealing and interpreting the culture. The key informants are chosen purposively, okay, guided by the ethnographer's informed judgment, although sample may become more theoretical as the study progresses. Okay, example of the ethnographic sample. Okay, we have this Sobrals. Okay, conducted an ethnographic study exploring the health-care seeking belief and behavior of the Mexican American men living in the Washington state. The researchers participated in activities within the Mexican American community, and they recruited participants through community organization, religious groups, schools, and personal contacts. The sample consisted of 8 key informants who varied in terms of their accu- acculturations, occupations, educational level, and interests. Okay, the sample also included 28 secondary research participants who were men and women with insights into the healthcare seeking belief and actions of Mexican American men. The secondary participants helped to validate the findings from the key participants. Okay, you have to involve yourself into the community for you to able to identify kung ano nga ba yung kanilang kultura. Okay, that is the primary goal of ethnography or ethnography studies. Okay, next, the sampling in phenomenological. Okay, phenomenologists, okay, tends to rely on very small samples of participants, typically 10 or fewer. Okay, there is one guiding principle in selecting the sample of phenomenological study. All participants must have experienced the certain phenomenon and must be able to articulate what it is like to that have lived that kind of experience. Okay, although phenomenological researchers seek participants who have had the targeted experiences, they also want to explore diversity of individual experiences. Thus, they may specifically look for the person with demographic or other differences who has or who have shared a common experience. Okay, example from Sigurd Gerdortir and Haldor Haldorsdottir on the year 2008 studied the existential struggles, needs, and experiences of patients in the rehabilitations. Okay, they purposely or purposive sample is 12 patients spanning an age range from 26 to 85 years and included men and women and patients with chronic and acute problem. Okay, so yun yung mga criterion samples nila or characteristics. Ano? So, dapat age range 26 to 85. Okay, men and women and patients with chronic and acute problem. Moving on with the sampling in grounded jury. Okay, grounded theory research is typically done with samples of about 20 to 40 people using theoretical sample or sampling. Okay, the goal in a grounded jury study is to select informants who can best contribute to the evolving jury. Okay, sampling, data collection, data analysis, and jury constructions occurs concurrently, and so study participants are selected serially and contingently. Okay, sampling might evolve as follows. Number one, the researchers begin with the general notions of where and with whom to start. The first few cases may be solicited purposively by convenience or through the snowballing. Okay, in the early part of the study, strategies such as maximum variation sampling might be used to gain insights into the range and complexity of the phenomenon under study. The sample is adjusted in an ongoing fashion. Emerging conceptualizations help to inform the sampling process. Okay, sampling continuous under saturation is achieved. Then final sampling often includes a search for confirming and disconfirming cases to test, refine, and strengthen the theory. Okay, a strategy of sampling confirming or disconfirming cases is another purposive strategy that is often used toward the ends of the data collection in a qualitative study. As researchers note trends and patterns in the data, um, emerging conceptualizations may need to be checked. Okay, confirming cases are additional cases that fits the researcher's conceptualization and strengthen credibility. These confirming cases are the new cases that do not fit and serve to challenge researchers' interpretations. Okay, these negative cases can offer new insights about how the original conceptualizations need to be revised, modified, or expanded. Okay, the example of sampling in grounded jury studies from um, Montgomery and colleagues in the year 2006 performed a grounded jury study of mothering while receiving treatment for a serious mental illness. Okay, the sample consists of 21 mothers received professional mental health treatment. After the first 8 interviews were completed, the researcher used theoretical sampling, okay, to capture the range of mother experiences. For example, they specifically suit to interview women who did not live with their children. Okay, critiquing the sampling plan. Okay, the type, critiquing the sampling plan. Okay, in coming to conclusions about the quality of evidence that a study yields, the sampling plan, okay, particularly for the quantitative study, merit special scrutiny. If the sample is seriously biased or too small, the findings may be misleading or just plain wrong. Okay? In critiquing a description of a sample plan, you should consider two issues. Number one is whether the researcher has adequately described the sampling strategy. Ideally, a research report should include a descriptions of the following. Okay? What are the type of sampling approach used? Convenient ba, snowball, purposive, or simple random. Okay, the population under study and the eligibility criteria for the sample selection in quantitative studies, the nature of the setting of the study group in qualitative ones. Qualitative studies may also articulate eligible criteria. Okay, the number of participants in the study and the rationale of the sample participants. Okay, so sufficient ba yung number ng participants or number of the sample size? Okay, a descriptions of the main characteristics of the participants. So yung eligible criteria ba has articulated well. Like for example, the age, gender, medical conditions, and so forth. Okay, in quantitative study, the number of and characteristics of potential subjects who decline to participate in the study. Okay, what are the guidelines for critiquing quantitative samples? Okay, so guidelines for critiquing quantitative samples. Okay, these are the guide questions. Is the populations under the study identified and describes? Okay, na-identify ba yung population ng study? Okay, are eligible criteria specified? Meron ba tayong eligible criteria? Are the sample selections procedures clearly delineated? Na-explain bang mabuti kung paano nila nakuha or paano nila ikakandak yung selections procedure ng ating mga samples? Okay, what type of sampling plan ba ang ginamit? Would an alternative sampling plan have been preferable, or was the sampling plan one that could be expected to yield a representative sample? Okay, how were subjects recruited into the samples? Does this method suggest potential biases? Okay, did some factors other than the sampling plan, example, the low response rate of affect the representativeness of the sample? Are the possible sample biases or weakness identified? Or are key characteristics of the sample described, the mean age or the percent of the female? Okay, is the sample size sufficiently large to support the statistical conclusion validity? Was the sample size justified on the basis of the power analysis or other rationale? Does the sample supports inference other external validity? To whom can the study results reasonably be generalized? Okay, for the qualitative sampling designs naman, these are the guidelines for your critiquing. Okay, is the setting or the context adequately described? Okay, is the setting appropriate for the research questions? Okay, meron bang um, kung yung setting pa is appropriate for you to conduct that kind of study. Okay, are the sample selections procedure clearly delineated just like on the quantitative? What type of sampling strategy? Ano ba yung ginamit niyang sampling method, sampling technique? Okay, were the eligibility criteria for the study specified? Nasabi ba yung mga eligibility criteria? Okay, how were participants recruited into the study? Paano ba sila na-recruit? Okay, did the recruitment strategy yield information rich participants, or they have selected very well ba that can enrich or that can give them sufficient data for their study? Okay, given the information's need of the study and if applicable, its quantitative or qualitative traditions. Was this sampling approach appropriate? Are dimensions of the phenomenon under study adequately represented? Or is the sample size adequate and appropriate for the qualitative traditions of the study? Or did the research indicate the saturations had been achieved? Or do the findings suggest a richly textured and comprehensive set of data with without any apparent holes or thin areas? Okay, are the key characteristics of these sample describes like the age or the gender, or is a rich description of the participants and context provided, allowing for an assessment of the transferability of the findings? Okay, that is the guidelines for critiquing for the qualitative sampling designs. Okay, so for you to avail to have a reliable result, okay, sampling method or technique might be identified very well because the generalizability and validity of the study perfectly rely on the full representation of the sample. Okay, that ends our discussion. Thank you very much for your listening.